Dear sister, today is Monday, May 7th, 2018. I thought that today I would talk about my most recent clinic visit, which happened a couple of weeks ago on April 25th. So it's been a little while, but I wanted to tell you about it because it was my yearly appointment, which, as you and I know, is the big appointment. We see everyone and do everything at these appointments. So I just wanted to tell you about it and how great it went. So, because it is my yearly appointment, we do an oral glucose tolerance test very early in the morning, just to make sure that I don't have diabetes, since that is a risk for those of us with cystic fibrosis. And so Jason and I, we drove to Fort Worth, which is about 4.5 hours away from me. We drove to Fort Worth on the 24th, which also was my 25th birthday. We ate at one of my favorite restaurants that night, and then we woke up really early the next morning for my oral glucose tolerance test at 7 a.m. So basically what they did is they take your blood immediately, they check your blood sugar, and then you have to drink 75 grams of carbohydrates, like a drink, and it does not taste good. I hate it. I have to plug my nose for some of it because it just doesn't taste good to me. And you have to drink that within 5 minutes, and then 2 hours from the time you drink the drink, they take your blood again to see if your pancreas secreted the insulin to bring your blood sugar levels back down to where they need to be after ingesting so many carbohydrates. So while waiting for the 2 hours to be up, we went and did my chest x-ray, which of course is really simple, really easy. They just take a couple of pictures and you're good to go. And then once the 2 hours was up, they took some blood, and then we went back to the hotel to shower and get ready for the day. My appointment wasn't until 1:30, so we ate lunch at the hospital cafeteria like we always do because they have amazing food there. It's fantastic. I love it so much, and I get the same thing every time. And then at 1:30, we went to my appointment. So I always get my weight checked, my height checked. They check my oxygen levels and my blood pressure, and of course check to make sure that you don't have a fever. So everything was pretty normal. My weight was 113 pounds, which was up a pound from when I was there last 3 months ago, so that was exciting. My oxygen looked great, and my blood pressure was normal. I didn't grow any, so that was disappointing, but oh well. So next, my nurse, Candace, came in, and she basically just makes sure that I'm doing okay and that I'm still taking the same medications. We go over all of my medications and how often I take them. I did mention to her that I was coughing a little bit more and actually coughing up more mucus, which is not a normal thing for me, and that I had increased my treatments kind of as needed. So that was something that we talked about. Whenever Candace was done, I went and did my pulmonary function test. And so basically, we get the 3 tries to get that number as high as we possibly can. So my first blow, I got 94%, and I was a little bummed because last time it was at 95, I believe. And I was like, oh man. And so I really tried to focus in a little bit harder, focused in more on where my breath was coming from, which I have learned from Singspire, the program that I have been in the last 10 weeks. So be looking for a video letter about that here in a couple of weeks. But I really focused on where my air was coming from, and the last 2 times I got 97%. So I was really excited about that. And then they actually ask you, since it's the yearly appointment, they asked me to do a Xopenex treatment, breathing treatment. So I sat there for about 10 minutes and did a Xopenex inhaled treatment to help open up my lungs and my airways. And then they have you wait about 15 minutes or so. and then come back and do the lung function test again to see how the treatment helped. So I did it again and I got to 98%. So that was exciting. And then I talked to my registered dietitian. She is really wanting me to focus in more on drinking more water throughout the day. I drink quite a lot of fluids and a lot of water, but she really wants me to drink more because I've had some bowel issues. So since I'm a registered dietitian, I am not afraid to talk about bowel movements. So here we go. Recently, probably within the last few months or so, I've really struggled just with constipation and diarrhea. And the past few weeks, I have not had a normal bowel movement. And so talked to my dietitian and my doctor about that. Because it's hard to not have a normal bowel movement. I mean, think about it. You have, maybe 1 to 2 normal bowel movements every day, and I don't get that at all. So, she and my doctor are adding Miralax to my daily regimen to see if maybe I'm just really blocked up, basically, in my intestine. My colon, and I might just have a blockage, and it's basically trying to come out, but it can't, so I get diarrhea or I get constipation. And so I was just taking Miralax kind of as needed, but it is now an everyday thing. So I've been putting it in my Carnation Instant Breakfast shakes in the morning, so that's been helpful, I think. I still haven't had a normal bowel movement, but I'm still trying to give it some time. So that's kind of been my main issue. But I also talked to a therapist who screened me for anxiety and depression, which I do not have. Praise the Lord for that. But something that we did talk about was just how exhausted I am all of the time. No matter how many hours of sleep I get, it's just very hard for me to get out of bed in the morning. It can take me up to an hour to get out of bed. And so she said, I think you need to talk to Dr. Burke about that. And I had talked to Dr. Burke about it previously. For about the past year, every time I come, I'm like, I'm still worn out, still exhausted. And Dr. Burke has said, well, you just may need more sleep than other people. And so this whole time I've kind of thought, well, maybe, maybe it's just the CF. Maybe it's just exhausting, living with this disease, and I've just kind of settled for being exhausted all the time, which has been hard, a 25-year-old woman trying to live a normal life, trying to keep up with her 2 dogs and her husband, and trying to work full time. It's been difficult, and so I decided to bring it up to Dr. Burke again. So I also saw the social worker. We really didn't have a ton to talk about. I didn't really need her services at this point, but it was nice to at least meet her and talk to her. And then my doctor and my nurse practitioner came in, and we have such a good relationship. I love being able to see them. My nurse practitioner, her name is Cindy, and she actually has a birthday the day after mine, so the 25th. Which also happened to be the day I was at clinic. So I had brought her a little gift just because she does so much for me and means so much to me. So we call each other birthday buddies. So we talked about the bowel problems while the dietitian was in the room. He agreed with the Miralax. And then when we were talking about my exhaustion, we talked about, okay, is there television in the room? What are you doing to get ready for bed, that kind of thing. How many hours of sleep are you getting? Which I get 7 to 9 hours every single night, which should be enough, but it's not. And he asked Jason a lot of questions, my doctor did, because Jason sleeps right next to me. He knows maybe a little bit more about my sleeping habits while I'm sleeping than I do. And Jason mentioned that sometimes I act out my dreams, maybe sometimes I toss and turn a little bit. And so I said, yeah, actually I've been having really vivid dreams recently, like every single night, very vivid dreams. And sometimes I do act them out, and that has woken Jason up before. And so my doctor says, you might have something called REM sleep disorder. And I was like, I've never heard of that. And so basically, I am just not getting enough sleep because I don't get into, my sleep cycle just doesn't go all the way through. So my body's just very exhausted when I get up. So they said that they would send me some more information on that. I'm still waiting on more information, but I'm hoping that it'll come soon and maybe we can have a solution to the problem. But as of right now, I have decided to work part-time, and so I will be quitting my job with Epic, which is really hard because I have loved my job so much and working with other people with feeding tubes. But I know it's the right thing for me at this time, and so I'll be going back to UMC, the hospital where I worked previously as a dietitian, and I'll work there part-time, and I'm really looking forward to it. So overall, my clinic visit went really well. My doctor looked at my chest x-ray and he was like, looks normal to me. So it was really exciting. I think my main issues right now are just my bowel struggles and the exhaustion that I'm experiencing every single day. So thank you so much, and I hope to hear from you soon. And I'll also be sending you a video letter in a couple of weeks about ʻsistər, the singing program that I've been involved in, and I can't wait for you to hear more about that. So I'll talk to you soon, sister.